To him while he was up here, and even our other children, that we just feel that, you know, if there was anything we could do to give back, we will, because they took just such good care of us.
Hayden Foose is overcoming his heart problem. Another challenge that faces some newborn infants is difficulty breathing. Jill Dittmeyer talked with the Hahn family about their daughter, Cameron.
Like any new parents, Justin and Michelle Hahn were ecstatic when their daughter Cameron was born, but they knew she would face challenges that most other babies don't.
So when did you first learn that Cameron had the diaphragmatic hernia?
When I was 7 months pregnant, they did another ultrasound, because at 5 months pregnant, they saw that I had a low placenta, so they checked again at 7 months, and that's when they saw that the heart was moved to the side. They weren't sure what it was, so they told us, we went down and met with Dr. Sumner's down in Indy, and he said it would either be a diaphragmatic hernia or a C-cam. And said he was about 98% sure it was a diaphragmatic hernia.
During pregnancy, the Hahns had learned that not all was right with Cameron.
Nowadays, the great majority are identified on prenatal ultrasound. Looking at the fetus, seeing many times, like in this case, the local obstetrician, the primary obstetrician, identified that the heart was shifted over. And in this case, from the right side, from the middle to the left side, and sent down here with a note saying that the kid probably has a diaphragmatic hernia, so our job was easy. Probably the most important difference between diagnosing prenatally and diagnosing as the baby is born is that we advise the family, we give them a chance to deal with this issue without having to deal with all these other events that surround birth at the same time.
Soon after she was born, Cameron began to struggle. Fortunately, the staff at the St. Vincent Women's Hospital Neonatal Intensive Care Unit, the NICU, were ready to care for her.
Dr. Whitman came up and talked to us in the hospital room, because we didn't get to see her until about 8 o'clock that night. And when she came up, she said she's not doing well.
Cameron was born with a congenital problem with her diaphragm called a diaphragmatic hernia. Dr. Ina Whitman, a neonatal perinatal medicine specialist, explains.
The diaphragm is one of our main respiratory muscles, and the diaphragm is located between the chest cavity and the abdominal cavity. During a baby's development in utero, sometimes that muscle doesn't completely form, and then there's a hole or a defect in the diaphragm, and that's what we call a diaphragmatic hernia. What happens when the contents of the abdomen, which are primarily the stomach, the intestines, sometimes the liver, when those contents herniate into the chest cavity, it doesn't give room for the lungs to grow. And so as the baby develops, the lungs don't grow normally, the lungs become very small, and then the consequence of that is that sometimes they're not able to support life.
Cameron was just 6 days old when the surgery was performed to repair her diaphragm and remove the intestines from her chest cavity.
Well, probably half of them don't make it eventually. So it's really a pretty risky circumstance. We hate to make that diagnosis because there's such a substantial risk of the babies not surviving. And then we just try to make the management as smooth as possible. The timing of the delivery so that the baby can be carefully managed, timing of the delivery according to how far along we are in pregnancy so that the lungs can develop as much as possible but not surprise us with a birth at an inopportune time.
If we wouldn't have found out while I was pregnant, she wouldn't have made it, because she was just that bad at the beginning.
After her surgery, Cameron was a patient in the Pediatric Intensive Care Unit at St. Vincent Children's Hospital, where she was assisted by an ECMO machine, an advanced piece of equipment that gives a child's heart and lungs the chance to heal.
The letters ECMO stand for extracorporeal membrane oxygenation. And what that basically is heart-lung bypass done here in the Pediatric Intensive Care Unit. The baby is placed on a machine that withdraws blood from the baby, runs it through a pump that provides cardiac assistance, across another machine that provides ventilatory assistance, and then back into the baby. So basically, the functions of the heart and lungs are taken care of by the machine, allowing the baby to rest.
After 6 weeks of ECMO therapy, Cameron was ready to go home.
What ECMO can do for a baby like Cameron is to provide all the heart and lung assistance that she needs, which enables us to rest her lung and not use high ventilating pressures. And while her lung rests, it can heal and grow, and eventually, with time and luck sometimes, the baby is able to get off of ECMO and then do well on her own lungs.
And once she was in the ECMO therapy, what was that like? How did that make you feel?
It's what saved her, without a doubt. I think had she been born anywhere else, she wouldn't be here. When she was on ECMO, right before she was going into surgery,
she was very, very swollen.
yeah, really swollen, and they said she's been trying to open up her eyes and stuff, and so I bent down, I'm trying to talk to her, I'm gonna start crying now. And you know, I'm trying to talk to her before she went into surgery, and I just saw that one eye open, and it touched me, you know, really.
He came back and said she's going to be okay.
Today, Cameron is 2 years old and going strong.
Congenital diaphragmatic hernia is still associated with a fairly high mortality rate. If you look at the overall survival, it ranges a little bit, but in general, about 50 to 60% of babies with diaphragmatic hernia will survive.
Well, for babies with diaphragmatic hernia, first and foremost, it's important to know that they're coming because they get the proper care in the delivery room. That's very important in getting the baby stabilized initially. Also, the surgeons can be ready and know that they'll have to operate at some point. The parents can meet the surgeons and know who's going to be operating on their baby to fix the diaphragmatic hernia. It also enables the neonatologist to let us know we may have a baby who will need ECMO, so we can have everybody ready and prepared that a baby may be coming over for ECMO therapy.
When we found out, we went right down to Dr. Sumner's, and he gave us an opportunity to pick which hospital, and we chose St. Vincent's, and we were able to go to St. Vincent's and get a tour of the NICU and see where we were going to be.
Meet with the doctor.
Meet with all the doctors there and the staff, which really helped ease our minds.
For the babies that do survive, many can do quite well and really lead a very good quality of life with time.
We are like the highest of hopes for what can be the outcome of this. You know, a lot of babies don't have such a good outcome, but right there shows you that it can be a good thing. They're wonderful down there. I can't, you know, with everything that we're going through, you know, they're even there to, you know, just to talk to you and just make you, even though you're going through such a rough time, they make it not seem as bad. She hasn't had any problems with it, no delays or anything like that. It's just, you can see, normal kid.
Today, Liberty Mahoney is an active 5-year-old, and though she doesn't remember, ECMO therapy also helped save her life.
She had been on 2 or 3 different types of respirators, and those just weren't working, and our last result to save her life was ECMO. At the time, she'd only been on ECMO for 5 days. She only needed it for 5 days, and that was the shortest amount of time spent on ECMO.
Just 5 months ago, the Mahoneys gave birth to their 3rd child, William.
First of all, no one could tell us why Liberty had the condition she had. There was no medical reasons why she ended up in intensive care. So we had nothing to avoid or stay away from for our third child, and so we went on in faith that everything would be fine. And William came out, and they, just as precaution, were checking his breathing and noticed that he needed a little oxygen. And as the day progressed, gave him a little more and a little more. And then we just started having this sinking feeling that, oh no, this could be happening again.
William was immediately taken to St. Vincent Children's Hospital using the St. Vincent Newborn and Pediatric Transport Services. St. Vincent utilizes specially designed ambulances that provide rapid, safe delivery of children from anywhere in the state with an onboard medical team that includes a neonatologist or a pediatric physician.
When he came up here, they were trying to describe his lungs as if he were premature. But again, he was a scheduled C-section, 39 weeks, weighed 8